it's easier for me to talk rather than talking in front of just a screen. So any one of you can keep your camera on, whosoever is comfortable with it. All right. So, so we are talking about chronic pain specifically today, and how chronic pain is different from any other pain. And that's the whole gist. And, that's something that if we understand and if we accept that, half of our problem goes away. You can't believe half of the problem goes away only if we accept that what is happening, and only if we have awareness of what is happening in our body. So let's take two scenarios. Number one is maybe you wore wrong shoes and your ankle just got twisted. You've got ankle sprain, and now this ankle sprain is hurting you. It's giving you all the aches and pain. So this pain, it came only after you fell, right? So after a fall, you got hurt or injured in your ankle, and you're getting pain nowhere other than your ankle. When are you getting this pain? Usually you're getting this pain when you are standing, when you're walking, whenever you're giving load to your ankle. So everything is making sense, and you know what is it. Even if the pain is very severe, you know that, because I just had a, fall, and that is giving me all the aches and pain, right? So it's easier to relate. It's easier to understand. Even if the pain is like excruciating, if the pain is very severe, we know that this pain will eventually get better. I have started the treatment, and we know the reason of the pain, and slowly and gradually it takes time and get better. It doesn't stress us much. Even if it gives us stress, it's a very, temporary stress that we get. Like, I had to go to a concert, or I had to go to my office. I can't go because of the pain that is around my ankle. So that's a stress that, you're missing your meeting, you're missing your client because of the injury. But it's a very temporary stress. As soon as you're better, you're back to your routine, you get better, and then it's gone. It's gone. You probably even forget that day when you were in excruciating pain. So this sounds easier. But what happens if this pain doesn't ever go? If this pain keeps on coming after every fortnight, when you go from one doctor to the other doctor and you're not able to relate that how it happened or what was the correlation, you did not even fall, but there is pain in your ankle, right? So in this case, it leads to a lot of confusion. And trust me, more than the pain itself, what troubles us is the fact that why is it aching? Why it's not going? What is one correct, solution to it? And in this flow of questions that we get further stressed. The stress is added because we are missing on the appointments, we are missing on the important life events, we are not able to do our usual recreational activities. These all further adds to the problem, leading to a condition when the pain is not just physical, but it is also a reason for all the mental issues. A lot of people experience depression, anxiety, panic attacks, and the moment they are exposed to that activity, they get fear. Even if the pain has not come yet, they are in fear that something will happen now, right? So what happens? Now the pain is not just physical, it has some psychological component also. So physical pain that has become psychological now, how does it affect your society? How does it affect people around you? So because you've stopped certain activities, so your group of friends, your relatives who know you because of your activities, like you love dancing, so you have a group of friends who love dancing as well. You have classmates from your dance classes, and people know that on weekends you're not available because you go to your dance class, but suddenly you have stopped doing it. And when you've stopped doing it, you're not able to keep up with those friends who are going, because either you're not meeting them, you're not able to talk very frequently, or you avoid talking to them because it reminds you that you are in pain. So what happened? Your social circle is changed now. Then whenever you are given any task, you decide whether you want to do it or not based on your pain. So what happened? It affects your productivity. It affects your work. So now what happens? This pain, which was initially just physical, it gradually became psychological, and now it has reached to a level that it has affected the social aspect also. So this is how the pain becomes a biopsychosocial problem, not just a physical problem. Okay, are you guys able to follow? Just give me
put a
heads up
thumbs
so
up
that
if
I
you
know
want.
you guys. Yeah. Okay. Perfect. Okay, thank you. So this is how the pain slowly and gradually becomes biopsychosocial. And when we have to address this problem, we address all of these aspects, and that's how the solution gets easier. Okay, but before we talk of solution, the question is, why in the world and what is the reason that only we have got this? Why is this hurting more than usual? Okay, so let's take somebody's example. So can anyone of you, or maybe all of you, can you just write in chat the pain that is troubling you? So I know Chandrika is she's affected with migraine headaches, which is quite frequent. Now, can any two of you also write pain where you have pain, so that I know what examples I should quote, which will be relevant to you, of course. So can you just write what pain do you have? Any two of you will do. Okay, let me write. I have back pain. I'll start with me. I do get back pain on and off. I'm much better now, but there was a time I had crippling back plus leg pain. Okay, let's keep it simple, very simple. I'm not writing the scientific term and all. I'm just writing the location. I know Chandrika, she has headaches. Okay, all right. So if you don't have pain, if you know any friends, relative, they have pain, then you can write that condition as well in the chat. Okay, so before we actually talk about the hacks, we need to understand that what exactly is the cause. Because patients whom I talk to, they often tell me that they are lost in the storm where they do not know where is this pain coming from. What is the reason? How did I suddenly get migraine? I never had migraine. None of my family members have migraine. Now things like sound, certain smell, music, traffic, it is all giving me headaches. The days I have very busy schedule, I have more clients, those days I get more headache. But this is not something that I'm doing now. I have been in this profession since a while, and all these smell, the sound, the traffic, it has been there forever. Why is this all giving me headaches now, right? So we do get these kind of questions when we are pain. How does this suddenly started affecting us so much, right? So we have to understand one thing, and that's the basic. Our brain is beautiful, and our brain is capable of changing every day. So our brain, which is today, is not what it was yesterday. It's better than that, or maybe it's worse in certain situation. Okay, now how it is better and how it is worse. Suppose as a child you love painting, and you were somebody who used to paint beautiful sceneries, but as you grew up, you stopped painting. And now if you go back to painting, you will realize that back in childhood days, you were a better painter. Okay, so what did change? What did it change? What was it? Why did like this change from a better painter back in those days versus not a good painter these days? Is this practice? Is it because you're out of practice? Can it be? Guys, I want it to be interactive. Just give her, just give your heads up, and then write in chat, unmute yourself. Okay, so that it's easier for me to know that you guys are listening. Neuroplasticity, amazing. So what happens? This part that now these days you're not painting at all, but back in childhood days you were painting a lot. So what happens? The things that we do over and over again, our brain has the capacity to make wires and connections in the brain, so that these connections makes you trained enough to do certain things. Okay, and this whole process is called neuroplasticity. Okay, neuro means, of course, it's your brain, something's related to the brain. Plasticity means it is capable of changing. Change can be positive and negative both. So neuroplasticity. Okay, now imagine that, let's take example of driving. So when we started driving in the early days, we were afraid, we were very conscious of the brakes, we were very conscious of the people walking on the road, we were conscious of the random, bicycle, rickshaws coming on the road. We were also conscious whether the rear view mirror is on the place or not. People sitting on with us are safe or not. We used to tell them not to shout, not to make any noise. The temperature of the car should be optimum. You don't want the wind or the draft coming on your face because you'll get disturbed. So, you want 100% attention and concentration when you're driving as a beginner, right? But what happens over the years? You keep on driving, 1 day, 2 day, 1 year, 2 year, 3 year, you continue driving, and then you become expert enough to drive. And even when people are shouting in the car, even when there's traffic, there's bumpy road, there is rain, anything happening inside or outside the car, it doesn't affect your driving. You can still drive. You can even turn on and off the music. You can take a call, not in the hand of course, but on the speaker. You can have a nice chat with the co-passengers. You can do everything, all the complex activity while driving, and driving safely. How did it come? It came with practice, and this practice that makes you habitual of something, that makes you go on autopilot. This is called neuroplasticity. Okay, but when we are in pain, the pain which is happening over 2 to 3 years or maybe more, or if you have noticed that certain triggers gives you pain, then what happens further? Your body goes on autopilot to recognize pain, appreciate pain. So even if it is a pain which is marginal there, or if it is a mild pain, you might feel that this pain is actually excruciating. Okay, like if I take this pen and if I prick myself, so I can just feel that this is pointed and this is uncomfortable. So I'll call it a discomfort. I'll call this a pointed kind of pain, and very localized, exactly on the spot where the pen is. Okay, but when the whole system of our body gets sensitive, because a lot of neuroplasticity has happened, and it has happened in a direction to recognize pain. Okay, and because it's been trained to recognize all kind of pain, and it's been trained to get very sensitive. So this one feels like that you are actually pricking all over, or instead of a pen, you're actually using a knife. This whole process is called central sensitization. Okay, central sensitization means that your whole system, your whole brain of recognizing pain has changed. You've got more sensitive. It's exactly the way you might get more tan in sun as compared to your friend, right? Some people get tan easily and some people don't get tan, right? So the only difference is sensitivity. The other example is allergy. Maybe you are allergic to peanuts, but your friend is not, right? So it's quite selective. So one is more sensitive than the other, and this whole process is called central sensitization. Okay, this term is very important for you. I know it's a bit of scientific word, but as a patient, it's very important for you to know this term. Okay, the way you know the terms like migraine, terms like tumor, headache, arthritis. So all these conditions and their names, right? Similarly, it's good to know the term central sensitization. This means that the body, the whole system has got sensitive. And when you understand that fact, the next step is to accept it. Accept that I'm more sensitive. Okay? So when you accept that you're more sensitive, the next bit is it to know that I'm actually sensitive. I feel it that there's a knife, but let me expect that it must not be something as harmful as a knife, right? So now earlier, maybe you could have been somebody who's, literally crying out of pain, shouting out of pain, not able to use the hand because there's a knife, right? But when you accept that your body is sensitive, and when you accept that, I get more pain than it is usually, right? Then you will calm down and you will know that, something is there, definitely, something is bothering me, but it's not as dangerous as a knife. So after this will help you to calm down, number one, and that's very important for you to work. And once you have, calmed down, then you can further diagnose. Just look at your hand, see visibly if it is there or not, or you can talk to a healthcare provider so that they can examine and see if there is anything wrong inside. And once they have given you a green light, a green flag that, there's nothing inside, then comes the trust. Trust your healthcare provider that there is nothing harmful. There is pain, it's not harmful, and it's not as severe as you feel. Okay? Now, after this, so first was to calm down, right? No, actually first was to accept. Okay? Let me word it here. So the first one, to accept. Then after accepting, what did you do? Your body got calm itself. Then after getting calm, you have run the assessment to understand what exactly is there. And once you have seen that, nothing, if your healthcare provider has told you nothing is wrong, or if they have told you that, there is a problem, but it's a small problem and it's a manageable problem, then trust. Okay? After the trust, you'll have to follow the treatment which has been advised for you. Okay? So follow the treatment. Okay? And is it one treatment? It's never one treatment. Okay? It's always a group. What it can be? Very easy. What all are you feeling? What all are you experiencing? Okay? Suppose if you are experiencing sleeplessness because of the pain, if you are experiencing agitation, irritation, if you are experiencing restlessness, if you're not able to eat properly, or if it is just a pain, right? So just list down what all are you facing and who can help you. If the pain is giving you acidity, if the pain is giving you poor digestion, or maybe it's making you overeat because you are eating a lot out of anxiety, then this means you need to talk to a expert who can create a diet plan for you which is healthy for you, right? You can also talk to a psychologist who can help you to fix the problems like anxiety, depression, panic attacks, right? Then what else are you experiencing? I'm experiencing pain which refers from one area to the other, or it radiates from one area to the other. Or if my pain is not allowing you to bend, turn, lift, then this means there is a problem with the movement as well. So you need to meet a physio, right? That is exercises. Okay. What else? Just keep on writing down what are the problems. Suppose you're not able to go to office or you're not productive at work, then list out what exactly are you facing. What exactly are you getting offended by things easily, or is it that you are not able to take extra work, you're not able to do overtimes, maybe you're not able to finish your work within the deadlines, or maybe you're not able to sit long. So what exactly is the problem that you are facing at work? And then again, if you're not able to sit for longer, this means a physio will help you. If you feel you're getting offended, if you feel that you're getting agitated, you've got poor tolerance, then you can again talk to your physio and have a behavioral therapy done. Or you can also talk to a pain psychologist on how you can cope up with the agitations that you are facing. Okay? Or if everything looks fine to me, if you're not able to list out, maybe you need relaxation. who all can help you with relaxation. Your physio can help you with relaxation. Your yoga therapist can help you with relaxation. Okay, you can follow your own spiritual beliefs to relax yourself, prayers and all, meditation, fasting, whatever helps you, right? So then opt for relaxation. So whatever you feel, whatever you are facing, list out and strike one box at a time, okay, so that you can cope up with that. All right, so I'll just write, list out again. You can follow a diet, you can do your mind body therapies. What else you can do? Relaxation, right? Okay, now what happens next? Suppose like my patients tell me that I followed all these things and I was doing everything, and then what happened suddenly? One day I got pain again. Okay, so this is called flare-ups. What happens is, whenever you get a flare-up, whenever you get a pain episode again, usually we think that it's not helping. Okay, we feel that I did everything, it did not help. So that's not true. Okay, what happens is, this means that your body needs a bit of more training. You're not gonna change, your pain is not gonna change overnight, right? So this means that yes, I've got pain, and accept that you have got pain. Okay, accept your pain, then slow down a bit. Okay, this means you don't have to stop. Okay, don't stop. This means, suppose, like talking of headache, if you have headache, you don't have to cancel all your appointments. Rather, you have to keep your day lighter. Okay, instead of taking 16 patients a day, you would like to take 10 patients a day. Okay, so I'm quoting Dr. Chandrika's example because she's a doctor, she's a dentist herself, and she has mentioned that she's got headaches, migraine headaches, right? So I'm taking her example. If any one of you wants me to mention your examples, then please list out so that I can mention. Okay, so what do you have to do? Slow down. So similarly in Simran's case, suppose Simran has followed all the guidelines, all the treatment recommended by her physio and her doctors and her yoga therapist, her mental health therapist, her dietitian, everyone, anything they have suggested, Simran has followed everything, and even then she got pain. Okay, so what she'll have to do? She'll have to first accept that yes, I've got pain, and that's okay. So do not blame yourself. Do not think that you have wasted time in your previous treatment. So accept that everything is gonna benefit you, but on its own pace. Okay, then slow down. If running is giving pain, maybe you would still continue, but instead of running, you would like to do brisk walk. Okay, so you don't have to stop running, you don't have to stop walking, you don't have to stop stair climbing. Rather, you have to go one step down. So for running, what will be one step down? Either don't run the way you run, like if you're running 3 kilometers every day, just run 1 kilometer. Okay, or instead of running, go for jogging or go for brisk walk, and as soon as the pain subsides, start running again. Okay, and for Dr. Chandrika, if you think that a busy day gives you headache, then maybe you would like to cut down the load a bit rather than canceling all the appointments and not going to the clinic. Okay, so this is how you would manage the flare-up. And once you are better, suppose the pain has got in control, you would again get back to the busy phase where you were. Run as much as you can, just take many appointments and introduce yourself to the trigger. Okay, so Dr. Chandrika, what are your triggers?
Mom, I exactly don't know what is my trigger, but as I said earlier, I might get on a busier day, but sometimes even if I'm not doing any work also, I do get. So I'm not able to point out what are my triggers. Mom, sorry.
Yeah, so this is again a very common thing. So thank you for sharing. A lot of people say that initially I had a very clear picture that why I'm getting, but now I have lost the track. So the easiest way is keep on writing all your triggers and expose yourself gradually to it. So that is called desensitization of your central nervous system. Okay, so suppose it's a busy day, it's TV, it's loud music. So slowly and gradually expose yourself on a very small grade, and then test yourself what is happening. If it is giving you pain again, don't panic. Don't think that you should have not tried. That's okay. It only means that you'll have to cut down the dose a little bit and then try again. Keep on trying, and then finally you will know that this trigger is not a trigger anymore. Okay, so don't stop and desensitize yourself. Okay, so these are the hacks that if you follow, it will help you to get rid of the aches and pain. Okay, I'll just write it again. Expose yourself to triggers. Okay, so if you follow all these routines, the researchers say that there's a high chance that you will get better. Okay, and how much time does it take? Does it take few weeks? Does it take 5 to 6 visits of physiotherapy? Or does it take few weeks or months? What do you think? What do you think? How long can it take to get better and get out of this chronic pain zone? Or is there a line or a timeline or not? Like, do you think you can get better or not? Okay, so yeah, please tell me, what do you think? A few new people have joined. Asfiya Khan is here. Bharat is here. Can I talk to you both? Asfiya, are you somebody who is in pain, or do you know somebody, or do you deal with somebody who has chronic pain?
Yes, I do have pain in my back, and it goes down to my heel.
All right, and how long?
Almost 7 years now, and I also have pain in my neck. And like you said, it is like on and off.
On and off. Okay, all right. And what are your belief system? Do you think you will get better, or do you think you'll not get better? What do you think?
100%. 100%. 100%. I'm a neuro-linguistic programmer, and I program my brain. That's how I've survived so far. And I do all that takes to manage the pain. I go to a chiropractor as well, physiotherapy, and I feel that I'll run a marathon very soon.
Amazing, amazing, perfect. So this is what we are talking today. So you will get better. You just have to find a way, and there is no one way. There are multiple things you'll have to do to get better, right? And Bharat, you're also there with us. I can see you've turned on the camera. Thank you so much.
Yeah, so it is Sangeeta. I'm like Bharat is on my behalf. So actually, yeah, I do have this kind of pains, and actually started with my mother's passing away. So that stress created a neck and a shoulder pain in me, and slowly, it has got aggravated. Like it's like any kind of stress kind of relation, it triggers me, with this kind of pains. So I have been working with Meghna for last almost 1 year and doing my physiotherapy. So I can say that I'm much better, but still I think I have a long way to go because it gets triggered with any kind of stress. So, but it's okay. I feel still as long as I can manage it, that is more important for me. So yeah, so I think I'm doing better, and I think I can become much more better in the near future if I continue my treatment with her. And I think I'm doing okay, I think.
Thank you so much for sharing your story. So, do you mind if I share you examples during our session today? Especially in terms of how, somebody's death, or, how a trauma, childhood trauma especially, can lead to aches and pain. Can I take your example? Feel free to say no if you don't want.
Yeah. No, you can take it.
Okay, thank you so much. So, as we discussed that the belief system, whether it will get better or not. So the first hurdle is people lose hope and they think that they will not get better at all. And when you have, made your mind that you will get better and you have to get better, this means you have already covered half the way. You've covered half the way, and you have made your job easy. You have made your healthcare provider's job easy by accepting the fact that it's gonna change. You will get better, and you will get better. It's not just a motivational talk, but definitely. Why? Because there is something called neuroplasticity. Even at the age of 90, if you decide to, bodybuilding, if you start bodybuilding, you can have that kind of body. You can have the muscle bulk like a bodybuilder. So if you can start training your muscles at the age of 90, then why not now, right? Also, if suppose you want to learn a new language, and if you want to learn it now, so it's not late, right? So if you can learn a new skill in your 90s, then why not in your 60s, 50s, 30s, 40s, 20s, and your teenage, right? So your brain always has neuroplasticity. It will always have it. It's just how you're going to program your body, as we have said. Okay, so we'll have to program our body. Amazing. So next thing is like the first one is to recognize the trigger. Okay, and just use a chart. Just go to your phone. Just keep on writing what all are the triggers, and then recheck it over and over again, that have I noted it down correct or not. Suppose one of the triggers that you have noticed is change in weather, right? Every time you go out in sun, it's sweaty, it's humid, and now you've noticed that you've started getting headaches, or because of the long day you've started getting back pain, neck pain. It can be anything, whatever is your current situation. So you have noticed this as a trigger, you have written it. You do it again. So don't think that this is my trigger, so I don't have to do it. Like fearlessly do it again. And next time when you do it, ask yourself, did I get pain this time or not? So once you cross-check yourself 3 to 4 times, you will understand whether it's an actual trigger or it was just a momentary thing. So you will help yourself to understand what all are your triggers. Okay. If at all you are still confused, talk to your healthcare provider. Share your notes with your physio that, I think these are my triggers. Let your physio decide when to expose you with which trigger to confirm. Okay, so that you are safe. So it's good to involve your physio. Have a list of all the problems that you are facing and the triggers that you have noticed, and ask them to, expose you one at a time and prioritize. So you will have to help them to prioritize. Like suppose your priority is to sit for longer, we can work on standing later, because you don't have to stand a lot as your profession. You have to sit a lot. So tell your physio that I want to work on sitting first, and then I want to work on walking first. So your physio will gradually expose you and train your brain through the process called neuroplasticity, so that you can start sitting slowly and gradually. And once you achieve that goal, they will come back to the standing. Okay. You will also notice that you still get sometimes pain in sitting. And that doesn't mean that you did not get better or it did not help. This just means that you'll have to continuously keep on training your brain. It's like a memory, like, out of nowhere, we get a scene of movie, we get a song in our head. And if we heard it in the morning, maybe throughout the day, we are singing the same line and it goes on autopilot, even if we don't want to do it intentionally. It happens to everyone, right? So similarly, even if you are recovered completely, there is no damage inside the body anymore, there's no nerve compression, there is no muscle weakness, the triggers are also resolved. Even then, if you are getting pain, this just means that you need to expose yourself more, you need to train your body more in a clinical direction, so that you can, come out of it completely. All right. So this is called gradual exposure of your triggers. Next is pacing. How would you pace? So pacing is, so whenever you are in aches and pain, slow down your activity. As soon as you're better, slowly and gradually increase the activity. Okay, this is called pacing. Now, what usually happens, the days we are better, we try to do a lot. Like, I'm in good mood, there's no aches and pain, let me host a party, let me invite my friends, let me go for shopping as well, because I don't know, as soon as I'll get the pain, again all my work will be stopped. So I better do it today because I have no aches and pain. So what happens, we plan a little too much, we take a little too much on our plate, which leads to another episode. So how would you do? Rather, make a list of things that you want to do and you're not able to do because of your pain. And the days you don't have pain, go to the list and do one thing at a time. Like today, suppose I have 10 things, let's say 3 things. I have to host a party, I want to go shopping, and I also want to go to the nearby city because I love traveling. So I have 3 things to do, and I am not doing it because of my pain. Okay, so what all I'm gonna do? So suppose today is a better day, I will finish one activity. For my next better day, I will finish the next activity. For my next better day, I'll finish the other activity. As soon when you continue doing this, you will notice that you are able to take or plan 2 activities in a day, and then you will get better. Further, you'll be trained enough to take 3 exertional activity in a day and come back without aches and pains. Okay, now I'll take Sangeeta ji's example. Suppose stress is something which is giving the pain, and it has a root, it has a link. Suppose she had a loss in the family, she lost a family member, and because of that there is aches and pain setting in the body, and that's quite obvious, right? Because in this situation, maybe she had to sit a lot. It's obvious. She had to do things which she has never done. There were people, she was getting calls, many calls, talking to the relatives, taking care of the other stuff, taking care of other family members, taking care of her own emotions. And what happens with this? So I'm sitting tall and smart, I'm confident, and now suddenly something happened, and now it's again something happened, my neck is going down, and if you see, my posture is also going down further. It has started giving me aches and pain. I started physio, I got better. Okay, but I got pain again, something happened, another trigger, I got another bad news. I have to finish lots of work in a short time, nobody told me, and now they are telling me I have to arrange so many things. Again, the stress is going on my neck, on my shoulder, my head. I've started getting aches and pain. And this when this starts happening over and over again, the brain thinks that this is a task that I have to be expert in. So what does the brain does it? It helps you to get worse. So it helps you to recognize pain. So the moment there is anything which can potentially give you stress, the brain thinks, oh, I got it. There is a stress, I have to give you pain because that's what I do every time. So even when the stress, even when the trigger is not there, you start getting aches and pain because the brain is trained in a way, right? So negatively trained. But the beauty of the brain is you can any day untrain your brain and train for better things. So this means next time when you hear a bad news, or when you hear that there is something which can potentially give you stress, okay, so and it can be some days, you won't believe, my patient tells me that there are things which are very trivial, like I've just washed my clothes, I've kept it in the sun, and it started raining, and this thing has started giving me stress which led to the pain. So people who do not have this kind of experience, they may feel that, why are you taking stress? It's nothing to take stress about. Why are you worried about the rain? You can always, the rain will eventually go away. Why are you stressing? So you may get, these kind of feedback from others. People might say, but what is happening actually, it's not you who's taking the stress. It's the brain which is trained to give you, stress related aches and pain. And that is called physical manifestation of your mental state. Okay, so how would you untrain yourself? Next time when you get a trigger, tell your brain, hold on, this stress is not a big stress, I can take care of it. I know certain set of exercise. Dr. Meghna has already given these exercises which will help me to get rid of pain. So before I get pain, let me take my hot pack, let me do my chin tucks, let me do a bit of strengthening. I've done my strengthening. I've told my brain that, this is not a big stress and I'm not gonna get pain. So what will happen? 2 things. Either you will not get pain. Trust me, it happens and it works like magic. You will not get pain. Or you will still get pain. And don't get disheartened. This just means that continue doing this until the time your brain understands that I don't have to respond to all the stresses with the pain. Okay, are you able to relate? Does it make any sense, Sangeeta ji?
So sometimes, sometimes it the brain understands and it is able to respond to this kind of message when you give to yourself. Like I start doing some deep breathing exercises, or I say, oh, it's all right, nothing is so worse. But sometimes it doesn't understand. So I feel get very confused that it 100% doesn't respond to this. Maybe it still needs more training. I think.
Absolutely, absolutely correct. So I think you're trained very well by Dr. Meghna, because you're giving all the answers, correct answers. So do you have children?
Yeah, I have two boys.
Okay,
One is
amazing. How old are they?
one is 20 and one is 11.
Okay, so you have seen, you have raised a teenager. So teenagers get rebellious sometimes,
Oh yeah.
unless you have done a very good parenting.
No, I'm telling you, trust me, my teenager is giving me a lot of stress already.
Correct. So
Okay, but
what happens? So
suddenly he's in a very rebellious phase. So that is also causing stress. But then, yeah, at the same time, I do understand that, this is a phase when they are always like that. But still, it is difficult to do it, when it actually comes to you, feel, oh, yeah, you can't handle it. But then sometimes, I feel, oh, no, it's okay. Many teenagers do like this, and it will be fine in some months' time, or maybe in some days' time, like that. So yeah, I do try. I'm trying all my level best, and I think I will succeed. Maybe on a point of 10, I think I must have succeeded around 50%. But maybe I still have
amazing.
to train myself more, for getting it back to really normal. Think it will eventually be fine, but it will take some more time. That's all I think.
Amazing. So I think, like, based on my assessment and the little that I heard from you, I think you're definitely somewhere in your 70%, because 50% is acceptance. So you have covered that. And with the way that you are able to, tell your brain, you are already, further 20% ahead. So you are, I think, 70% better. And going back to that example, can you recall any of your family members or your friends? People are in 30s, maybe now 30s and 40s, who were very naughty as child.
I Means, are you talking? I should give some example. I
Yeah.
didn't get your question actually. I did not understand the question.
So can you recall, like, do you like, can you think of anyone who was very naughty as a child? Anyone?
Oh yeah, my younger son was very naughty as a child.
Correct. And he's not anymore, is this?
No, yeah, definitely I can say that now he's 11, and yeah, he's not at all naughty now. He has calmed down. He's much better now, than what he was when he was a child.
Exactly. So whenever we get stress, okay, or our triggers, so this continuously gives us pain, okay, and we tell our brain, and we do exercise. It's not that we are not addressing, we are doing exercises also, we are doing relaxation also. So with exercises and relaxation, we have done the treatment part, and now we are reassuring the brain by doing a bit of positive self-talk that nothing is going to happen. So there will be days when the brain will not listen to you, the brain will still give you pain. There will be days when the brain will get very rebellious, and it will give you more pain than it usually gives. But there will also be days when the brain will listen to you, right? So the idea is here to have more good days and less bad days. Okay, so suppose, just notice, like, how often do you get those stresses, and how many, like, suppose this month there were 5 to 6 triggers, okay, and out of which, if you were able to cope up with 50% of the stress and 50% still gave you pain, and then just keep this data on you, and maybe after 4 months you notice that now, like, 80% of my triggers do not give me pain, 20% it's still giving me pain. Then going further, you will reach to a level when you'll see that 100% my triggers are not giving me pain anymore. This means that you are now trained enough. Maybe in 2-3 years you will get pain again, and that day you'll think that I thought I'm better, how did I get pain again, right? So that is the time to tell yourself that my brain is going on flashback. It's like deja vu. Nothing has happened. Don't worry. Let me do my breathing exercise. Let me do my therapeutic exercise, some chin tucks, some strengthening, and just calm down and I'll be fine. Right? Check if you have left being active. Sometimes the pain comes back because you've got better completely and you have stopped doing everything, all the care that you were giving. Okay, so like your child was very naughty, but now is much better, but this doesn't mean that you'll stop caring. You will continue caring even when your child is in the best behavior. You will stand at a distance and still notice if the child is fine, even without interfering, just to keep safe. So years later, when you're absolutely fine and you still get one episode of pain, just calm down, do your exercise, and stop it then and there, so that it doesn't become an episode over and over again. You will notice that in 2 to 3 years you got just one episode, then maybe in 5 years you got one episode, then maybe in 10 years you got one episode, and then you realize that you're not getting episodes. Like, it's been like 20 years I have not got any episode. So this is how chronic pain gets better. Unlike any other injury, I got fractured, I was on bed for like 2 months, and now I'm better, and then I'm absolutely better. Now it's finished, rehab finish, right? So that's not what happens in chronic pain. So that's why in chronic pain your physio becomes your friend. You reach out to them whenever you want. Correct. Right? Sometimes relevant, sometimes irrelevant, and that's completely all right. Okay, so this is how it works. And if I have to list out all these hacks, then if anyone of you wants to write, you can write it down. So number 1 is your pacing. Okay, so you should know how to pace. So when you are better, do certain stuff, work, okay, but make sure you don't overload yourself. Okay, the days you have aches and pain, make sure you don't go on bed completely. Remain active, continue doing things, but lesser in quantity. So remain in moderation. I'm better, I'll remain in moderate physical activity. I'm in pain, I'll still remain in moderate physical activity. I'll not overdo unless my physio gives me a heads up to overdo or underdo. Don't just go for bed rest unless your physio tells you to go on bed rest, even if the pain is very severe, because your brain is trained in a way to tell you it's severe, it's severe, it's severe. You need a validation. Either ask yourself that, do you think if the damage is there? If you think no, there's no damage, I haven't done anything which can give me pain, then probably it's just negative signals that you are getting. It's a false alarm. So calm down, continue doing your activities of daily living, continue your kitchen work, continue your reading, writing, your patients, you're going to office, continue doing it, but don't take any extra load. Like after your office, don't go for a movie and don't go for meeting to meet your relatives and all, right? So do what is a moderate activity for you. Next is mindfulness. It's very important to practice mindfulness. What all are the mindfulness? Mindfulness can be your breathing exercise. It can be your religious and spiritual activities. It can be your hobbies. It can be talking to your favorite person. It can be music, going for movie, anything that pleases and suits your mind. So that is your mindfulness. Okay. Then comes progressive relaxation. So relax your body one at a time. Like I'm trying to relax my face. I'm trying to relax my hands. I'm trying to relax my legs. And there are various techniques. If you Google, you will find so many techniques for progressive relaxation. If you feel your diet, your body weight, your sleep is also getting affected, then work on it also. Okay. Then next come your cognitive retrospection. So whenever you're getting all these negative thoughts, ask yourself that, is it fair on me? Am I being too hard on myself? Am I being kind to me or not? So cognitively ask yourself, am I just, avoiding activities out of fear, or actually, I should not do certain things. So retrospect, question yourself again and again, to and fro. Okay. Next strategy can be, be trauma informed. So a lot of people get aches and pain because of difficult childhood. Okay. Or any guilt. If they have a guilt, survivor's guilt is something very common. Like one of my patient was in a very dangerous car accident. He was, young guy in his 20s, went on some mountains. There was a car accident. All his friends died, and he was the only one who survived. And even after surviving, he had the survivor's guilt. He felt that he should also not be alive. He should also die with his friends. So this guilt gave him all the aches and pains, especially on the location where he got pain. So definitely he was also injured. He was in ICU for a longer period of time, but eventually he got better. But the pain did not leave him, right? So sometimes the reason for the pain is just trauma, difficult childhood sometimes, getting beaten by the parents or bullied by friends in school. It can also be body image related. Maybe if you are overweight and people were telling you to lose weight, you drastically lost weight and you got weaker. People started calling you very skinny and thin and flat. And now you feel that, all these changes in your body has given you aches and pain. Or every time you go to a doctor, they tell you to lose weight. And that is leading to a problem of, the pain which is not getting better. So these are trauma-informed. So for this, you need a trauma-informed therapies where, a psychologist especially, they are trained in trauma-informed therapies. They help you to cope up with that, to come out of it completely. And if the aches and pain are movement related, you can also work with a physio to work on it and overcome your triggers, your fears, and your thinking errors, and finally come out of it with green flag that I'm all good. So these are the and if I have to sum up everything in two categories, then you need a good mind body therapy and you need a good movement therapy. All right, and when you make these things together, you get better. Along with that, you need to know one thing, that you will get better eventually, and you don't have to lose your confidence, you don't have to lose hope. Okay, and there is one more thing. Whenever we are in pain and we go to a doctor, the doctor prescribes you some painkillers, right? But do you know that we already have these opioids, these painkillers in our body? It's like kept in your pocket. Okay, so how are you going to take it out of your pocket? So it is by stimulating your brain. And how do you stimulate your brain? By doing activities which releases these happy hormones. And these happy hormones, they are strong analgesics as well. They reduce the pain. Okay, and sometimes it's just a distraction theory. Okay? If you distract your mind 100%, the fight and flight hormone also helps you to reduce the pain. They work like strong analgesics, that is painkiller. Okay, just think of example. You must have seen in movies, the protagonist, the hero is injured. There is there's gunshot injury, there's a broken leg, and the hero is still running. And we see and we laugh that how is this person still running out even with all these injuries. But it's not completely false or faking. It's somewhere true, because there are hormones. These are called fight or flight hormones. Okay, these hormones, they are stimulated out of stress. When you have life-threatening situation, and in that time you focus on your goal, and that is to run away from this situation. So you would run, even if somebody is running behind you, you would run with a broken leg, but you will run, right? So this hormone can push you to that limit, imagine. And if you stimulate this hormone on your own, definitely you can get better. And how do you stimulate these? Distraction theory, or stimulation by exercise, relaxation, dance, hobbies, mindfulness, your spiritual and your religious support groups. All right, so these are certain tricks that helps. I will try to send you all a copy of on how to do it, some actionable points, so that you remember. Take a printout, stick it on your refrigerator, your office, keep a wallpaper on your phone, your laptop, so that whenever you get any aches and pain, you know what to do. The list is right in front of you, and this will definitely help you to get better. And if you need more, specific help, if you need more, personalized care, then definitely Dr. Meghna's whole team is there, where you get all kind of therapists, and where, in HealthQ Rehab, where we can help you to get better as a team, right? So, yeah, this is us today. Is there any questions for me? Please unmute yourself and tell me if you have any questions. Are you guys still there?
Yes, we are still there. No questions. No questions as such, but you've given us a lot of food for thought, and we'll certainly implement all of that. And then maybe after implementation, we might come across certain doubts or questions. This is from my side.
Thank you so much. Yeah, that's true. So that's the spirit. Try it yourself first, and when you need help, we are always there.
Yeah, I would also like to add that, yeah, certainly after hearing you, I can identify myself with the condition which I am facing, and it gives me a lot of hope that there is that you can become much better by doing this kind of techniques. So yeah, I would like to thank you so much for it.
I'm glad that you are here and you shared your condition, so that we had a discussion which you could relate. We used your example, so thank you so much for giving me the consent to share about your condition.
Yeah, thank you.
Mom, I just want to add some more things. Whatever you said throughout the 1 year, it was not only applicable for the pain, but it was also applicable for my dizziness, for which I had approached Meghna ma'am, and madam's exercise helped me. But also that neuroplasticity principles, like there's one book called Skubinar. He has given that Under Your Pain by Dr. Skubinar, one of the author. The same principles, whatever you said. Now that was it was a ditto thing. I mean, I could relate not only the pain but also the dizziness factor, which I'm not recovered completely, madam, but at least I came out of it like by 90%. So the same principles work, like the exercises, and whenever I'm getting dizziness, I try to go, though I don't avoid my clinic. Now, before I used to take off and stay at home, but now I'm doing not that much. I mean, I'll try to go, but I'll come back early. So whatever the principles you said, it was 100% correct. Seriously, ma'am, that was great session, ma'am, seriously. Thank you so much.
I'm glad Thank you so much. Thank you. I'm always approachable. You guys can have my email address. You can reach out to Meghna. I'm there on the app. So even if you feel that you're lost, or you still want to have this discussion again, have this session again, so we can always do it, because we all need reminder. And
how can we approach you, madam? Sorry.
I'll write my email address here, and of course Dr. Meghna is there. She'll help you to reach out to me. I'm there on HealthQ. You can book an appointment through HealthQ.
Chandrika ma'am, she is a part of our team, and we are working together. So if you have downloaded our app, right, so there is her profile, and you can directly connect to her through that. And anyway, Sara has shared her email ID as well, so you can anytime reach out to her.
Okay. So I have written certain things in the chat, how the whole flow goes, except if at all you want, you can take a screenshot, or just copy it somewhere. If not, then I will anyway send you a flyer, which you can just stick it everywhere you want. This is me. Yeah, so I'm done from my side. Lots of talking.
Great. No, thank you so much, Dr. Sara. It was amazing. And I believe pain, when it turns chronic, or not only pain, in terms of any movement related issues, when it turns chronic, it brings a lot of mental changes. Now, pain is considered as a musculoskeletal problem, or is a problem that's related to your muscles and bones, but somewhere it's a neuropsychological problem, or else you can say neuromuscular problem as well, especially when it turns chronic, and which goes absolutely unrecognized and unaddressed if it is delivered in a very conventional manner, where you just go for some therapy sessions, take machines, and you just go out of it. Pain is likely to come back. But if we address the pain from a very holistic perspective, specifically from a neuroplasticity perspective, then a lot can be changed. And I believe all the patients of us who have gone through that journey have themselves realized that consistency, keeping positive attitude, positive approach, and kind of working towards getting better every single day over a period of time becomes a habit. that habit itself helps. So and when you come as an expert in CBT and talk about it, it gets more validated, not only to them, to us also when we are practicing. And yeah, thank you so much. I also learned a lot, and I hope every one of you found a value. It's the basic principles. So pain management is not a rocket science. It's just applying some basic principles in the right way at right time. If applied, it definitely works. All you need is a guidance and a step by step manner, because you don't know what is the right time to apply what, and that's where people like us can help you. So please reach out anytime if you need any help, and if you have got any doubt after the session also, Mansi is there. She's our program coordinator, so she would be helping you to reach out, and if you have any particular question for Sara, for me, or anyone, she would be able to take that question and reach out to us, and we would be answering that back to you guys. Great. So I hope the sessions was good, and we can now take a pause from here.